Never miss an episode of Create, Build, and Manage Daily again. Subscribe to our podcast and listen on the go.
Dr. Danielle Bailey believes it is important for you to take care of your entire body. Dr. Bailey is the owner and CEO of 360 Health and Wellness Services, and she joins me in studio tonight. Dr. Bailey, so glad to see you.
Thanks for having me. Glad to be here.
Absolutely. So walk us through the different services that you offer.
Yeah, so we offer physical therapy, which provides services for individuals that might experience some type of condition with their shoulder, back, hip, things like that. But we also specialize in pelvic floor physical therapy, which is specifically for individuals that may experience some form of pelvic floor dysfunction. And that includes things like urine leakage with coughing, sneezing, laughing, exercise. You know, you wear those yoga pants to disguise that. And so we provide services for individuals that experience some of those types of issues, even for women that are pregnant or postpartum, and maybe they're experiencing, discomfort during their pregnancy or after they've had a baby. And we also provide physical therapy for people that might have pain with intercourse, whether it's been a long time or just maybe after having a surgery. We're able to work with individuals that experience those types of symptoms.
So you cover a wide range there.
A wide range of services. Yeah.
So I think the nature of what you're talking about can make your clients feel a little bit uncomfortable.
Yeah.
Coming to you. So how do you put them at ease, make them feel welcome, and make them feel heard?
Yeah, absolutely. So one of the things that I love to do with all of my patients is to really establish a rapport with them when they come in. Oftentimes they'll come into the clinic and they'll say, I felt rushed at my previous provider's office. So I take an hour and a half with each client on their first visit, and we really talk through in depth about all of their symptoms, their history, how long it's been going on. And then we do a formal physical assessment too to actually assess the body to see what's going on. And through that established rapport that I create with the clients, I'm able to really provide that connection with them. And then they begin to trust me. And they're like, you know what? I never knew this existed before. I'm so glad I came. Right. So that's really important for me as a clinician to be able to create that connection with my patients and make them feel valued, validated, heard, so that they're able to achieve those health goals that they have for themselves.
It's really about getting down to the root cause. And I think that's where a lot of people in your profession maybe miss the mark, where they treat the symptom and not the root cause. So how much of time and tension on the front end do you spend trying to find the root cause of the pain?
Yeah, such a great question. We do that right at the beginning. And that's one of the reasons why our initial appointments are so long. I also incorporate functional medicine in my practice, which works to discover the root cause for our clients. And through the assessment that we do, and we're talking about, what's been going on for a long time, I ask them, what's your diet like? Mm-hmm. What's your stress level like? What's your environment like? And by asking those questions, we're able to look at different factors that might be affecting one's symptoms. And so for some patients, we'll say, hey, why don't we do a diary for a few days? I want you to jot down what you've eaten, what you drink for a course of a few days, minute by minute or hour by hour of the day. It takes a lot of work and intention, but through that, we're able to see, what they're doing throughout the day that might be contributing to their symptoms.
The website for those who are watching on BizTV tonight is 360hws.com. And if you're listening to the podcast, you want to write that down if you can safely. It's 360hws.com. I think often, Dr. Bailey, we kind of excuse, I say we, I'm speaking for the generic people out there, we're not doctors. We just blow it off as, it's old age, and we don't do anything about it. Yeah. At what point should we see someone professional? Should we seek, because look, over the weekend, I go bowling, I haven't bowled forever, and I'm feeling muscles I haven't had in a long time. That's probably just, muscles. But at what point should we seek professional help?
Yeah, that's such a great question. I think, there's something called proactive care and reactive care. Obviously, when something hurts us, we go to a doctor or a physical therapist to try to get healed in that manner. And I think that's great. Listen to your body. If you're experiencing something acutely that is bothering you, get in right away. But I also think it's important to be proactive. So maybe you may not be having anything going on that's overtly a problem for you, but just say, you know what, I want to get assessed. I want to get checked. I want to make sure I'm okay. Because oftentimes we can discover some things that are underlying that may not initially manifest itself for the patient. And that just helps the client to become more proactive in their health so that they can avoid things from happening in the future.
Preventive care is always more affordable too.
That's right. That's right. Yeah.
Makes sense. Now, you're passionate about collaborating with other health providers. Why is that?
Yeah. This world is so big and I can't do everything on my own. And I think when you really collaborate and connect with other people that serve the same types of clients, patients ultimately receive the best outcome for their health. So if it's a midwife or an OBGYN or chiropractor, a doula, a massage therapist, a nutritionist, if we collaborate together in trying to help the client as a whole, they experience the best results. And so I've learned that it's not all about me. I do the best that I can do, but if we can be able to provide clients with our specialized care together as a community, then I feel that patients ultimately receive the best care.
I like that.
Yeah.
And it just shows that you do care about the patients.
Yeah.
Now, you have 2 locations in the Dallas-Fort Worth area.
Yeah.
I believe Dallas and Plano, right?
That's correct. Yes.
And so what's next for your company?
Yeah, so we're just in the growth phase. We are going to be adding a massage therapist to our practice. So for people that need massage therapy, they'll be able to have that as well. Our goal is to grow into a bigger space as well, to be able to serve more people. So we're really excited about that.
What do you love most about your work?
I love being able to connect with people and to be able to journey with them through their healthcare challenges and to be able to see the outcome. That is just one of my passions, to be able to hear someone say, you know what, I no longer, leak on myself when I cough or sneeze or exercise. Or, I've been feeling so stressed out and my hair was falling out for months. And after seeing you, my hair is growing back. Things like that.
You got a lot of people's attention with that.
Yes. It is just rewarding to be able to work with a client hand in hand and really help them achieve the healthcare results they want.
Dr. Bailey, I appreciate it. That website again is 360hws.com. Again, type in the number 360hws.com. Check out what Dr. Bailey's working on. And if you're in the Dallas-Fort Worth area, you can visit one of their 2 locations in Dallas or in Plano. Stick around. This is Create, Build, and Manage Daily.